Nurse. What comes to mind when you hear that word? Most people would say white uniform, administers medications, works in a hospital, older female. Those are a few of the descriptions that come to mind when asking individuals to give their first thoughts on what they think is a nurse. The image of today's nurse has changed significantly from the one that was commonly portrayed in film and literature. No longer are nurses older females wearing the crisp white uniforms with a needle in their hand. Today's nurses are younger, and although it still remains a predominantly female occupation, more and more males are starting to appear. Today I will be giving you a glimpse into the nursing profession, what the job entails, and the important role communication plays. I am a licensed practical nurse, and have been working in a hospital on the surgical ward that specializes in orthopedic surgery. I've been working as an LPN now for 3.5 years, and I'm enjoying it tremendously. I can honestly tell you that this career choice is one that is both fulfilling and gratifying. You may ask why. Well, let me tell you. But first of all, let me tell you that this job is demanding in many ways. Physically, the long hours on one's feet, and assisting patients with their activities of daily living and their mobility. Mentally, the need to be alert and continuously formulating your plans of action throughout the day. Emotionally, the tendency to become emotionally attached to the patients and their families due to their situation and through day-to-day personal interaction. Let me invite you to share a typical day with me at the hospital. The day begins upon arrival on the ward. You will be greeted by a group of nurses, smiling, saying their good mornings as you walk into the team center. One thing you may notice is the lack of blinding white uniforms once associated with nurses. Instead, you'll observe the many bright colors and prints on nurses' uniforms. You will also notice that the median age of the nurses would be around 30. The age of nurses on our floor varies from 20 to 45 years old. Everyone gathers in the conference room to listen to the report from the last shift. The shift consists of 6 nurses and 1 clinical manager. During report, each nurse listens to the details of their patients. Average patient load on our floor is about 6 per nurse, while formulating a game plan for the day. After report is completed, each nurse makes rounds on their patients, doing their introductions, putting a face to the name, and asking patients regarding any concerns and inquiring regarding the patient's level of pain. By doing this initial round, a nurse can formulate or reformulate his or her game plan and course of action for the day. Because this is a surgical ward, the main focus is the patient's mobility and rehabilitation. The importance of getting a patient out of bed is fundamental because the risks of developing pneumonia and blood clots is greatly reduced with increased mobility. Pain control is also a focus on this ward because inadequate pain control equates to decreased physical activity. A patient cannot properly carry out their physiotherapy if they are in a large amount of pain. Therefore, it is a nurse's responsibility to ensure that the patient pain is adequately managed. Each nurse completes a head-to-toe assessment on each patient and assists the healthcare aide working with them to get the patients up and washed. Once all the patients are up and ready for physio, the nurse can then follow up on any new orders, review the discharge status of their patients, and preparing discharges. The remainder of the day entails changing patients' dressing if it's time or if it's required, instructing the patients on the self-administration of the needles. Our ortho patients each receive a prescription for anticoagulation needles that they must administer themselves, and this helps prevent blood clots. Discharge teaching with patients and actual patient discharge. As patients are discharged, new ones arrive from recovery room, usually in the mid-afternoon. And the nurse assigned to accept the new postdoc must do several things. First, a report is given to the receiving nurse from the recovery room nurse, including details of the surgery and the patient status. The recovery nurse would also discuss any concerns pertaining to the patient. Once a report is taken, the nurse then ensures that the room is prepared, and the nurse then waits for the porter to bring up the patient. Upon arrival, the nurse does a complete head-to-toe initial assessment on the patient and ensures that he or she is comfortable and carries out the protocol regarding the patient's pain management and vital sign routine. Remember that this all happens in one 8-hour shift. When a nurse receives a fresh post-op, he or she is still responsible for the other patients and all of their scheduled medications and treatments. And they still have to be carried out. And this is where proper time management skills plays a huge role. Around 1 hour before the shift is over, the nurse must then write out a brief report on each patient with only the need-to-knows and not the nice-to-knows for the nurse coming on to the next shift. One major constant that you may notice is communication. Every part of nursing consists of some form of communication, be it patient to nurse, nurse to nurse, doctor to nurse, family to nurse, or nurse and other disciplines. Without proper communication skills, patient care cannot be carried out properly. From the beginning of the shift, information is passed on from nurse to nurse regarding the patient's status. Throughout the day, patient and nurse interaction is consistent. Patient communicates his or her needs and concerns both verbally and non-verbally. The nurse educates each patient and develops a personal rapport with each patient to carry out each necessary task. The nurse also communicates with other disciplines: doctors, physiotherapists, occupational therapists, home care coordinators, all as a part of each patient's care plan. Communication between the nurse and the patient's family also occurs when discussing any issues or details. Different forms of communication continuously occurs throughout the day and is crucial, for the lack of it could have negative consequences, such as med errors, misinterpreted emotions, and missed orders. After experiencing a taste of a day in nursing on a surgical ward, would you say that this career is for you? If you have great communication skills, enjoy the gratification of seeing the progression of a patient from post-op to discharge, and have excellent time management skills, then maybe it is. As I said in the beginning, nursing may be demanding in many ways, physically, emotionally, and mentally, but the rewards, including the bonding achieved, far outweigh the hardships it takes to get there.